And somebody, Nazia Shireen, has asked about differences between macrocytic, microcytic, and normocytic anemia. So I've mentioned that anemia can be classified according to the average size of the red blood cells, which is referred as mean corpuscular volume. And as per that, we classify it into three categories, which is microcytic, normocytic, and macrocytic. And you have also asked me about, so yeah, does menstrual cycle has a huge connection with iron deficiency, or is it a myth? So no, to answer your question, Nazia, I mean, what I mean is any kind of abnormal bleeding from any side, like which I mean is a heavy menstrual bleeding or an abnormal uterine bleeding, a fibroid or cyst. I mean, as a hematologist, obviously I can treat the iron deficiency here, but as I mentioned that the root cause has to be treated. Otherwise, it's a vicious cycle and you will keep coming back with the same problem.
Right.
Yeah.
Dr. Anamika, and that child where you discussed the 3-month-old child with megaloblastic anemia. Can you hear me?
Yes, ma'am.
Right. So, like, when
Yeah,
should
I can hear you, ma'am. I can hear
when
you.
should we suspect, for example, in this child, maybe there was a clinical scenario, but at times, I'll just
So,
talk about a normal
right.
female who has an infant, less than 1-year-old child, and as a neurologist,
Yeah.
I see a lot of like children with ADHD, and these children usually have anemia during their infancy. So at times, and I find it difficult. What are the red flags? I mean, what should be the warning sign that now the mother should go to the doctor to look for anemia? I mean,
So, ma'am, so as I mentioned, she was a 8 month. She was actually a 7.5, yeah, almost nearing 8 month infant who came to my OPD, and she was an exclusively breastfed infant, not started on weaning by the mother. She was only continuing breastfeeding, no formula feed, nothing, but only continuing breastfeeding, not started weaning the child. So, firstly, she should have. I mean, ideally, one should start weaning at 6 months of age, as breast milk itself is not sufficient enough to cope up with the amount of calories required for supplementation. First was that, and the mother herself was a vegetarian,
okay,
not consuming enough milk, not consuming enough products with milk, and plus she gave history where she said that the baby was gaining adequate weight till 1 or 2 months of age, and suddenly there was a drastic decline, and she suddenly fell down to from 50th centile to third centile.
okay, okay.
Can you hear me, ma'am?
Yes, yes, we can.
Can you hear me, ma'am?
Yes, we
Am
can.
I
We can
audible?
hear
Okay,
you.
okay. So yeah, and as when I saw her, and when I saw, okay, so when I saw her CBC, the most striking feature was NCB 110, and also CBC showed me of 121. So she probably, and once at a B12 level for her, she has vitamin B12 deficiency, and her vitamin B12 levels were less 54. So which
Right.
was very significant. And also this particular mother is the same picture that knuckle pigmentation that I showed. Mother had classical knuckle hyperpigmentation.
Okay. Right.
So that's when I thought that probably I should be
So,
keeping nutrition
no,
deficiency.
definitely,
Right.
mother's nutrition is important when we are thinking of anemia in a
Yes,
child,
yes.
right? And also the type of
Yes,
food,
especially in a breastfed infant.
right? And also the type of food,
Right.
basically. And if, for example,
Yes.
during these like small infants जो हैं, उसमें भी we'll have to do the proper investigations and look at rule out thalassemia and rule out sickle cell, right? I mean, in these children, or do they
So ma'am,
follow?
so if you're talking about this particular case, my second DD actually would have been a congenital bone marrow failure syndrome, since she came
Okay.
with failure to thrive, vomiting, diarrhea. They also present with such kind of signs and symptoms with significant anemia, also with significant thrombocytopenia. But she was not a dysmorphic looking child, and her length was appropriate for age. She was failure to thrive, certainly, but length was not at third centile, it was at 50th centile. So not genetically, she did not appear dysmorphic. Sickle cell, I would not say she did not require any repeated admissions for pneumonia or for
Okay.
any repeated infections.
Okay.
Yeah.
Clinical presentation would be a slightly different.
Yes, ma'am. Yes, certainly.
Right. Right. And I mean, now do you do genetic testing for especially congenital anemias, and like, do you recommend that also
So,
nowadays?
ma'am, if you yes, there is there they do test for inborn error of metabolism when a newborn is born. So that's a different panel. But as far as anemia is concerned, we're not going to do a panel, especially in a newborn
Okay,
who's
newborn with
active and
anemia.
not really suffering from. Who's a normal newborn, we wouldn't really recommend
No,
a
if for example,
specific panel for anemia at this point of time.
in case some child comes up with sickle cell or uh, basically, or आपका thalassemia, there do you do genetic testing also? Just like wanted to understand.
So yeah, NGS panel is one panel. So NGS panel is one panel. Next generation sequence is one panel that we do suggest for hemolytic anemias, and that is something that it's a very upcoming test, and I think every hematologist or probably every physician should think of doing it. If you're not, if there is an infant or a child who's come with severe hemolysis and you're not able to pinpoint a particular diagnosis, probably your HPLC is normal, and if yeah, all the other basic tests like osmotic fragility, DCT, ICT, everything turns out to be normal, then and if the child still persists to have anemia, one must certainly get an NGS panel done.
Right, right. And like, for a male with anemia, let's say there is an elderly gentleman with who has come to with anemia. You mentioned that hemorrhoids are important. So I mean, I have
Yes,
this apart
very
from
important.
hemorrhoids, I think malignancy should also be ruled out in these cases. I mean,
Yeah.
this what I used.
So, ma'am, usually in our OPDs, those patients are directly referred from medical oncologists. Like, for example, let's say a patient had gastric adenocarcinoma or end of solid malignancy, especially a GI malignancy, and he or she did receive chemotherapy 6 years back, or was operated or underwent a duodenal bypass,
Hmm.
or any of gastroduodenectomy, any such procedure was done on the patient, then, and if the patient has been referred by a medical oncologist to a hematologist in view of persistent low hemoglobin, then I would certainly suggest for a colonoscopy, direct the patient to a GI surgeon for a good rectal examination for hemorrhoids, to look for any kind of jejunal duodenal polyps, because they do have such things, and it is commonly missed. They just continue to have fatigue. They don't really address that to the doctor unless a CBC is done, which shows a drastic fall in hemoglobin from 10, it will certainly become 5 or 6. That's when they present to us.
Right, right, right. And I think these were the question, at least in my mind, regarding anemia management, which I asked. If there are further on, like, more questions from the attendees, please unmute yourself and you would be able to ask you that.
Please, yes,
And
please do.
I think they don't have too many questions. But then, if in future also you have any question in mind that regarding anemia or anemia management, Dr. Anamika has already shared her email ID and her telephone number. She would be available at her center in Rohini, so you would be able to contact. Otherwise, you can message us, and we'll be able to. It would be a pleasure, our pleasure, to help you out with sorting out your queries. And I think, Anamika, this.
So Nazia asked some food items that can. There's some question by can you list some food items enriched with iron? Yeah, so certainly all green leafy vegetables like spinach
Right,
and jaggery, pomegranate, all those things. But again, I mentioned you have to have a wholesome diet, incorporating all sorts of your veggies, and if you're a non-vegetarian, then certainly include eggs and incorporate eggs and fish.
right.
Yeah.
One of our seniors always used to say कि दूध जो है लोहे की कढ़ाई में उबालो. So I'm not sure. वैसे तो calcium and iron chelate each other. So I just have been wanting to ask this question. We usually do not give iron with calcium, and one of the seniors used to say कि.
No, ma'am, and it shouldn't really be given iron with calcium, as you mentioned. Yeah, okay, yeah. Since you mentioned this point, ma'am, good that you mentioned. I also want to mention this through this presentation that a lot of patients who take oral iron supplement, they come to a PD saying कि doctor साहब मेरा iron कुछ नहीं हुआ, and they are compliant. They did not have any adverse side effects. Neither did they have constipation, diarrhea, nausea. But they do come to work कुछ हो रहा है, because also it's the doctor's responsibility and the hematologist's responsibility to explain them how one should take iron. So please either take it empty stomach. If you are taking calcium, then please make sure that there is a good difference of timings between iron and calcium, as ma'am has mentioned. So take it with only plain water. So these are three things that I tell all the patients in the OPD, taking not.
I think we lost you, Dr. Anamika. So I think what she wants to say is we should keep a separation between any meal that contains calcium and the iron. And
Yeah,
while
yeah.
30 minutes or 40 minutes of difference should be there. That is the time that usually the GI absorption.
So, and also, yeah, 2 hours prior to or before meals, at least 1 hour, at least
Okay.
a minimum of 1 hour,
Right.
before or after meal. Yeah.
और आयरन यूटेंसिल वाला क्वेश्चन, आई एम सॉरी वी लॉस्ट यू इन बिटवीन. सो आयरन यूटेंसिल्स में खाना बनाने से कुछ फायदा होता है?
Yeah.
राइट, डज इट गो टू द फूड? हेलो, I think there has been some technical issues or internet issues with at Dr. Anamika's end, but I think in the lecture we have already covered all the common causes, what should be the approach, when to evaluate, how to evaluate, and when to give blood transfusions or intravenous iron preparations, and how to give them. And apart from that, there are different clinical scenarios, both pediatric and adult, wherein anemia evaluation should be targeted.
Sorry, ma'am, I think I lost you in between. You were saying something about utensils.
Right. So basically, making food in iron
Ma'am, yeah, so to ask you, to answer that question, so basically it also depends upon the amount of leaching of iron and clearly, matlab, it depends on the pH level of the food that you're cooking inside that utensil. Also, it depends on the dilution of the food and the time required to cook that food in that utensil. All those factors also make a huge difference, even while whether you're cooking in an iron utensil or not, all these parameters make a difference. So not really though.
Right, right. Otherwise, I mean, iron deficiency anemia would not have been so prevalent. Most of our lower socioeconomic strata people, they make their food
Yes.
in iron vessels. Right.
Rural areas and yes, exactly. Yes, ma'am, that's true.
Right. And I think this was what I was saying before we lost you, and that we have, anyways, you have covered very nicely in your lectures what are the common causes, what are the atypical causes, when to evaluate anemia in a child, what should be the red flags, and what are the different causes that we should keep in mind
Yes.
in pediatric population as well as adult population. And there are definitive indications for IV iron formulations, and similarly there are definitive indications when you
Definitely,
should
yes.
give blood transfusions. So base, and especially where there is
Yes.
anemia.
So IV iron, there are a lot of people who ask why do you directly give IV iron? Is a lot. I've been asked this question quite a lot, and I always tell them that obviously if a patient has oral iron intake and you know that is complaining of persistent gastrointestinal side effects, and you know that this patient not be a compliant and does require iron therapy, you must not even think twice and give iron therapy. And any kind of oral iron fractures where hemoglobin despite compliance has improved period of weeks, that should consider give IV iron, or any patient with intestinal disease like atrophic gastritis, inflammatory bowel disorders, H. pylori infection, anybody who is under gastrostomy or duodenal bypass surgery, all these things as I said, ma'am, history is very important. If you keep, if you ask this history, then it was really easy for us to decide whether to give IV or oral. And as far as blood transfusion is concerned, that's also a question that most people ask, that why do you want to give IV iron and why not blood transfusion? But blood transfusion comes with its own pros and cons. Mostly cons, where it's considered there's a very high risk of transmission of various viruses, we all know. So, and obviously, I mean, if a patient comes to you with a hemoglobin of 4 and 5 and complaining of chest pain, fatigue, palpitations, you certainly must admit and counsel the patient for blood transfusion. And along with that, later on, it is an immediate and emergency measure. It's not something that one should do in their routine practice. Let's say if a patient's hemoglobin is 6 and the patient is relatively stable and has just come to you because the cardiologist or the neurologist referred that particular patient to you in view of low hemoglobin, no sign symptoms, then we can evaluate the patient further and counsel the patient for IV iron therapy in that case.
Right. So your limit for blood transfusion is the threshold is like 5 or 6, right?
Yes, ma'am. And also, as I said that, in case, let's say if a patient's hemoglobin is 6 and even whatever, patient is relatively stable, you can no signs and symptoms and has not come to you to the OPD by themselves due to any problems that they are experiencing, but has been referred by a neurologist or a cardiologist. In a stable patient, we must, not transfuse iron, but evaluate further and think of IV iron. It all depends on the physical examination and the history of the patient.